Hi, this is Dr. Christine Bishara interviewing Dr. Russell Kennedy. Dr. Russell Kennedy is a psychiatrist and a best-selling author of the book Anxiety RX, which has sold over 100,000 copies. And I'm really looking forward to interviewing you today, Dr. Kennedy. Thank you for coming on.
Oh, you're welcome, Christine. They call me Russ.
All right, I will.
I
Um,
will fix one thing right off the bat, though. I'm not a psychiatrist.
you're not?
So, no, I have I did a family practice for 20 years, and there's pros and cons to not being a psychiatrist because I
Mm,
think when you do a psychiatry residency, you really get steeped in drugs for 5 years. And so like I said, there's pros and cons to it. I think what I try and do is try and lean on the neuroscience part of it, which psychiatrists don't typically get a lot of neuroscience. So that's how I do it, and mostly why I specialize in anxiety is because as you know, suffered from pretty crippling anxiety for like 40 years.
right. Well, I think a lot of people kind of go into the specialty or the field that they love based on a lot
Hmm.
of personal experience.
Sure.
But yeah, I've read your book. I think it's great, and I think everyone should get it. And I know you have a part two of it, or kind of a
Hmm.
revamped
Right.
Anxiety RX. And I really think you're spot on because your explanation of anxiety to me makes so much sense. I think so many people are treating the mind, where you talk about the alarm, which is an internal body alarm. So let's talk a little bit about that.
Yeah, I think most traditional therapies try and treat anxiety, which is, kind of at its core overthinking with more thinking. And I don't think that works. I think what happens to us is we get overwhelmed by something when we're children that doesn't get repaired or resolved by our parents or caregivers, and it stays in us, and it stays in the sort of the cellular memory of our bodies. And then that, unless we address it directly, gets reflected by the mind in this process called interoception, where the mind is always reading the body. And when the mind reads this old alarm, this old unresolved wounding in our bodies, it creates stories and worries that are completely consistent with that feeling of alarm. So it creates warnings, what ifs, worst case scenarios, because as a child, that's how we felt. And I believe this part of our brain called the insular cortex mediates the mind to the body and the body to the mind, kind of like the way station between top down and bottom up. And I think there's a lot of studies that are starting to show now that the insular cortex is affected with PTSD, with anxiety, with unresolved childhood wounding. And I think because our body gets disconnected from our mind, we lose that grounding in our body. Now, the paradox is that the alarm is actually held in our body too. So we have to kind of make friends with our body in a way because it's kind of holding this old alarm to protect us,
Right.
but what the mind does is it starts making up stories as to why they have this alarm. And I love that David Goggins quote that says, the mind has a tactical advantage over you because it knows your worst fears. So it just uses your worst fears against you. So my theory of anxiety is it's mostly a form of alarm that's held in the body, typically from unresolved childhood wounds, although it can be from other things. And that reflects through the mind. So the mind is really only reflecting this old trauma that's held in the body. And if we just try and treat the mind, we're trying to treat a symptom rather than treating the underlying cause. That was my rant.
Interesting. So tell me about the alarm. How is it presented? Is it always one particular thing or?
It can be a number of things. I find that about half the people have one source of alarm. Like for me, it's in my solar plexus, but other people have it in their throat. They have it in their heart too. And it's really trying to find,
Mhm.
rather than when people get anxious, I will ask them, okay, where do you feel that? I know you're worried and your mind is trying to figure this out and create all sorts of warnings, what ifs, worst case scenarios. But where in your body do you feel that? Because most people don't. They just stick in their heads and they think, I can fix this with my mind. Well, you can't. You just make more worries. So it's really understanding that when you get anxious, can you look to your body and see if there's a place of pressure or pain or nausea or some place, typically between your chin and your pubic bone in the midline of your body, that kind of lights up in a way and feels really uncomfortable?
Hmm.
Because I believe that that is sort of, without going too woo, the younger version of you that's trying to gain your attention. And anxiety fundamentally is a separation of your adult self from your child self and a separation of your mind from your body. So the adult doesn't want to go back to the child because the child holds all their pain, and the child doesn't trust the adult because the adult has kind of left them alone for decades. So it's really
Wow.
understanding that as we put our mind and body back together, which is why yoga and exercise and all that kind of stuff helps. But as we connect this adult self to the child self that never really got that repair that they needed, we start healing the root cause of what's causing the anxiety in the first place, which is this, cellular memory, this body memory that's still stuck inside your body.
Okay, so I talk a lot about like gut brain stuff,
Sure.
and um, I think a big one that a lot of people feel when they're anxious is that butterflies in their
Oh,
stomach
sure.
sensation.
Yeah.
So is that considered an alarm?
I would consider it an alarm for sure because, as you know, the vagus nerve innervates the gut, and
Right.
the gut is a real, it's a real powerhouse for healing, and also it can make us feel really terrible as well, as you write in your book. So it's really understanding that it's trying to make friends with this almost at a spiritual level, without bringing in too much, kind of woo to this. It's healing at a spiritual level because I think we're mind, body, spirit. And I think typical medical doctors are okay at mind, fairly good at body because we put a lot of time into that, but not really that good at spirit. And I think spirit is where this sort of intangible, irreducible thing that we can't sort of scientifically say, hey, here's your scientific treatment for anxiety, because it doesn't work, because it doesn't incorporate that sort of spiritual aspect of us that is unconscious, and that we need to sort of connect with this kind of unconscious part of it that we pushed off to the side for so long before we can heal. The downside of that is when we bring up the unconscious, the old part of us, the old wounding, it's painful. Like, it's
Painful.
really painful. So
Yeah,
people don't want to go there. They'd rather, kind of take a pill or and I have nothing against psych meds, nothing at all.
right.
But people would, in a way, rather do that than actually go back and treat the underlying cause, which in some people I don't blame them because their wounding was so severe.
Yeah, that brings up two questions. So one, I want to go back to that alarm, the butterflies in the stomach, but you bring up medications that people take medications to deal with it. But I also think a lot of people don't even take the medications. They use substances, right? Do
Oh
you think,
yeah.
I feel
Oh,
like
for sure.
anyone that's chronically abusing substance, it has some underlying childhood wound that they just can't handle. It's
Almost
easy
always,
too.
Christine.
Yeah,
Almost always. It's very rare that I see somebody with chronic anxiety or depression or OCD or eating disorders who didn't have some real deep unresolved childhood wounding. It's very rare.
and I'm going to add narcissistic personality disorder in there too, because
Sure.
you were mentioning in the insular cortex, and I've read articles on people with NPD, and their insular cortex is also affected.
Yep.
Like it gets bigger, right?
Yep. They
Yeah.
don't feel themselves because I think it gets bigger out of adaptation in a
Mhm.
way. So if we don't feel our
What's the function
body,
of the insular cortex? Do you know?
well,
No.
it acts in disgust for one. It has a real framework on the body. It's kind of like a ghost. Um, it has this framework or this blueprint of the body in it inherently.
Hmm.
And if we don't connect to it, if the connections in it are impaired or hyperactive, we don't get that sense of like, oh, in our body where we just feel like we're watching a sunset with our partner and we're just like, everything is good right now. Everything is okay, right? So, but we live in this dopamine driven environment where now, instead of like that serotonin here and now kind of thing where we're like, oh, this is so nice. It's more like the dopamine. Oh, this would be a nicer sunset if we were in Hawaii right now. Like
Right.
this society is always driving us to want more,
Yeah.
and it sort of it depletes us. And when we get more, it kind of cheapens the more because we get it so often now. It doesn't have the same resonance, or
No.
beauty or impact that it would have, 30 years ago.
Right. I agree with you on that. Like I think about people who are so involved in videotaping something or taking pictures of this really big event
Right.
and not actually enjoying the event.
Yeah.
And I've fallen prey to that. Like I listen to my husband a lot because I'm like, do you want to take the pictures? He's like, no, I just want to enjoy
Yeah.
and have that memory in my head, right? But I think you're right. I think we've just become a society where there's this instant gratification all the time,
Hmm.
all the time. But I wanted to ask you about the like the butterflies in the stomach again. So you know how they say that sometimes when you have those butterflies in your stomach when you meet somebody, or like even like romantic
Yeah,
people that
for sure.
do you think that's kind of a almost this reactivation of an alarm to some kind of wound that it reactivates or reminds the person of?
It's a very interesting question, Christina,
Yeah,
because we don't come together by accident in
we
relationships.
really don't.
And I mean, there is this theory that we pick partners that are similar to our parents, which on some level is true, but we
Yeah.
also have this concept called the Freudian repetition compulsion, which was
Mhm.
the patterns that were familiar to you in childhood, because human beings equate familiarity with security, and that can be very dangerous, especially if the familiar patterns in our
Yes.
childhood
Yes. I
were
talk about that all the time. Yeah.
yeah, bad. So I think there is this sort of reactivation of these things. And the benevolent thing is, oh, we're meeting this person because they're giving us a chance to heal it. I hope that's true, but I think it's just hardwired in us to repeat what was familiar to us in our past. Now, the byproduct of that may be that you have a chance to heal it, but with the divorce rate and all that kind of thing, I don't think people really, and this is, this is another question for another day, but I don't think people hang in relationships now as much as they would have before because of this dopamine driven
I,
nucleus accumbens, immediate gratification. There's always something better out there, right?
yeah.
So it is this thing that I do believe that when we do meet somebody who kind of mirrors our old wounding, there's either an attraction or a revulsion.
Mm-hmm.
It's like those people that, like, I'll never smoke because my dad smoked 2 packs of cigarettes a day and I found it just disgusting, right? So I think it's funny how we either, you know, follow these old patterns religiously almost, or we get a revulsion from them, which again, disgust is the insular cortex. So it's really
Yeah.
interesting how it all kind of works back.
Mm-hmm. To me, the insular cortex seems to be something that collects all this data, right? And it's like this camera that just kind of screenshots your whole life and keeps it
Yeah.
all. Um, it's interesting because yes, I agree on the romantic partners, but I also feel like you attract friends and people that you have in common with. And then you find out that you had very similar childhoods and
Totally.
upbringing and similar traumas. And again, it's not a coincidence that we find each other, right? We all kind of
Yeah.
find each other. It's very strange.
And again, it's energetic. It's almost
Yeah.
spiritual, And I think as we learn more about the brain and we learn more about spirit, I think we will be able to reduce it on some level and studying it a little bit better. But there we'll never really get to the end point of like spirit, like what really makes us human, like this intangible thing that's irreducible and not amenable to empirical study. Like we just can't study the spirit. And I think it
Wow.
drives people crazy because we see all these things, and you and I both know this, where we see, empirically, science-based therapy or evidence-based
Right.
therapy. And every
Right.
time I see that, it's like, okay, a good coping strategy. That's basically, it's
Yes.
not going to heal you,
Yes. Yes.
right? But
Yes.
it's going to give you coping strategies, which,
Yeah.
and there's nothing wrong with those. But, we want to sort of get to the root cause of this stuff, like
Yeah.
gut stuff. You want to get to the
Yeah.
root cause of it rather than just throwing drugs at it or throwing band-aids at it,
Right.
because, you're going to be throwing drugs at it for the rest of your life.
And you make an interesting point because I think science focuses so much on the concrete, right?
Right.
What evidence do we have concrete wise, but not the spiritual and not the almost not the rational and the critical thought.
Hmm.
Like this morning, I actually read this article that popped up in my feed about uh, the incidence of lung cancer increasing in younger women who are non-smokers.
Hmm.
And then I kind of read a little bit more and I'm like, I wonder why women in their 20s, 30s, and 40s are now having lung cancer more than males who are
Hmm.
smokers. And I kind of just started thinking about it. First thing I thought about was candles, right? Do women just burn more candles? And
Maybe
I don't know.
it's a
So I
good
started
thought.
thinking about it. I'm just thinking, and this is the non-science, right? Because
Sure.
science wants evidence. But then I was reading more about it, and Asian women tend to have even more. Like two-thirds of
Really?
the lung cancer incidences are in Asian women. And then I started thinking about, well, what makes them different? And then I kind of just started digging, and it's possibly due to the cooking oils and the fumes
Hmm.
because they cook at really high temperatures, right? Like
Right.
Chinese women have very high incidence of non-smoking related lung cancer. I'm only
Yeah.
saying this has nothing to do with us, but I'm just saying this because I think we tend to focus on the concrete and the evidence base. And yes, that's great, but you're right. There's something about not necessarily spiritual in this case, but
Yeah.
I agree with you. There's just something about kind of going with a hunch or just a rationalization thought about it. And I think we need to do more of that. And I think as scientists, we don't have enough of people like you who really dig deep into this and use
Yeah.
yourself also.
Yeah. I
You,
like, yeah,
yeah,
I like to kind of, I still consider myself a scientist in a lot of ways, but because I've seen so many things that are non-science based really
yes,
help people, I'm
yes,
kind of like, okay, let's be open to a lot of this sort of stuff and see. So I'm a little more woo, well, I'm a lot more woo than a lot of medical doctors for sure.
me too.
But yeah, but it's just I think that's part of the healing, like the mind, body,
Yeah,
spirit thing. So if
yeah,
you have someone coming in to see you, you can't just sort of fix their body and sort of ignore like with the lung cancer thing. You can't just ignore how they got there or
right.
what could stop it in the future. And sure, science helps us understand this stuff a little bit better, but I think science can be a bit of a crutch for people. And this the whole religious debate too, like is there a God, that kind of thing. Because I think on some level, faith, and not necessarily religious faith, but I think faith helps heal people. Like
That-
when people lose hope, they lose faith, as you know, like they die pretty quickly.
yeah,
I would see that in my practice. When they lose hope, it's like that's it. And that's the spirit part of us. And I think it's so needed, especially in emotional dysregulation, anxiety, depression, eating disorders, personality disorders,
yeah,
all this stuff. I think we really need to find the spirit in us and accept, because we all have negative traits. We all have things, but we also have to go back to that child that we've been admonishing for so many years and say, hey, you actually have the best parts of me,
mm,
rather than saying, oh, you're too sensitive, or, as a, you got bullied, so there must be something wrong with you. Like we so focus because of this fear bias in our brains. We so focus on the negative of the survival that we don't actually pay much attention, like turn the lighthouse over to, hey, what's great about me? Like my
right.
generosity, my sense of humor. We don't focus on that stuff nearly enough. And I think that's where the kind of the spiritual part kind of kicks in a little bit.
Yeah. Well, and you're somebody who has spoken a lot about your anxiety and
Mhm.
suffering from it and how you came to this point. But you don't seem like somebody who's anxious to me at all.
No, and I think I've learned how to hide it well, especially being a medical doctor. I learned how to hide my anxiety really well. And so many people with anxiety are really, really good at hiding it. And I think one of the things that when I look back at my life, I kind of hid it from my intimate partners.
Mm,
I kind of bait and switch them a little bit because they would see me and they would see this doctor who was, you know, fairly funny and reasonably attractive and that kind of thing. And they think this is a great guy. And then when they get in there, it's like I'm an anxious mess some days. And it's like I didn't sign up for this. But I think a lot of us anxiety people do that, is that we're, and then when you meet somebody too, you kind of got all this oxytocin rushing through your system,
right.
and that eases your anxiety. Because I think, you know, getting back to the spirit part, the real part that heals us is love. And if we don't allow love specifically for ourselves, but we search for it. And it comes back to what you were saying about partners before, is that you kind of attract people that you think are going to give you the love that you need. And maybe you create this image in them and they have this back and they reflect it back to you. And early on, I think it does work. I think when you meet somebody and you have anxiety and it's great, and then the first 12 weeks are amazing, the anxiety drops considerably, and
Yeah.
which tells us that, the antidote to anxiety is love. And it's being able to love yourself overall, which sounds kind of airy fairy and love yourself and whatever. But
Right.
it's
Right.
really true. I think
Yeah.
I think love is a great substitute for benzodiazepines
Mm-hmm.
and
It's a
vice
dopamine
versa.
rush, right?
Yep.
Well, and I've read that that whole like spark plugs, whatever, is it's almost like your brain recognizing the familiarity, and because it wasn't able to fix it as a child,
Totally.
it's now like, okay, give me another chance. I can do this, and then
Yep.
you kind of fall into the same trap. So tell me what you do or what you've done to help with your anxiety. And my other question is, do you think some people are just more inherently anxious than others, or do you always
I,
think
I
that anxiety comes out of some kind of
I
trauma?
think that some people are more inherently sensitive than others.
Okay.
So you
Yeah.
ask a mom, which of your kids is the most sensitive,
Yeah.
immediately they will tell you which one is the most sensitive.
Right. Yeah.
So we're seeing more data that sensitivity, temperament is kind of
Yeah.
genetic. It's kind of
Yeah.
genetic. So if you're a sensitive child and you grow up in an environment where there's lots of love and attunement and connection, you'll be fine. But
Mm,
if you're a sensitive child and there isn't enough, which is not to say there isn't any, because there's lots of I see people who had reasonable parents who are still anxious
mhm,
because they just needed more. They
mm,
were just very sensitive beings and
mhm.
just couldn't get quite enough love in a lot of ways.
Yeah.
And with the family these days, with both parents working and all that kind of thing, like we're seeing an epidemic of anxiety in our younger
Yeah.
folks because the parents are out working. They're not there actually
Right.
supporting the kids as
Yeah.
much.
Well, the
So
parents
it's
are out working and the kids aren't socializing anymore with one another. And so
with
they're
their
always on
screens,
their
like
device.
they're on their
Yeah.
phones,
Yeah.
right? And
Yeah.
there is this thing called the social engagement system, eye contact,
Yeah.
tone of voice,
Right.
prosody of voice, body language,
Right.
facial expression. These are the things that when we were younger and we were out playing with our friends or talking with our friends, we would gauge this and our brain would
Right.
mature, right?
Right.
But now the kids aren't getting that social engagement
No.
system matured. And that social engagement system is what helps us soothe others and have empathy, because empathy is dropping in our kids as well. And it also helps us soothe ourselves. So
Right.
if we don't learn how to soothe ourselves with this building this mature social engagement system, we're creating a generation of kids, and we see it all the time, who are just really anxious. They're really
They
struggling
are. No, they
because
are.
they
The
don't
studies
have
are
that.
showing, yeah, that kids are a lot more anxious than 20 years ago.
Absolutely. Yep.
Yeah. I think
And part of
COVID.
that screens for
Yeah.
sure. They're not getting the social
Yeah.
engagement. But I
Yeah.
think it's just the world is more stressful. Even though life is easier for most of us in many, many ways,
Yeah.
the disconnection, my mentor in developmental psychology, Gordon Neufeld, says all anxiety is separation anxiety. And
Mm,
I agree with that. And then I tag on to that, and it's mostly separation from yourself.
yeah. Very interesting. I wanted to talk to you also about psychedelics because I know that
Mhm.
they've been now starting to utilize them more so.
Yeah.
And I was kind of opposed to psychedelics in the past because I didn't really know enough about them.
Hmm.
But then I watched a documentary and I read up on them, and they're actually pretty beneficial and pretty helpful in a lot of conditions. I don't know if you saw the documentary, How to Change Your Mind. Have you seen that?
I read the book, Michael
Yeah.
Pollan's book.
Okay.
Yeah, which
Probably
was
better than a
amazing.
documentary. Yeah.
Well, yeah. I mean, it's not, I think the thing about psychedelics is it's not a panacea. You
Yeah.
have to ultimately do that work and find that younger version of you that's wounded and pull
Right.
them up and bring them into the present moment and show them that I have this acronym I call should. This is what you should have got when you're younger. You should have been seen, you should
Mm,
have been heard, you should have been opened to, understood, loved, and defended.
mm,
Now, a lot of us didn't get that. So it's our job now to show that younger version of ourselves that they're seen, heard, open to them, understood, loved, and defended. So it's creating that sense within yourself that, yeah, there's parts of your childhood that were difficult. And a lot of times what we will do is we'll blame ourselves as children, for stuff that goes on in our households. Children blame themselves. And that pattern almost gets stuck into the default mode network. And that's when our brains aren't doing anything, we're constantly sort of spoon feeding ourselves like, oh, you're inadequate, oh, you're not this, oh,
right.
it just, you default when your brain is in this sort of daydreaming, not doing anything stage. You default into this negative self-referential thinking, which is going to beat you down over the course of time, right? So I don't know where I was going with that
Well, no,
initially.
but I think some people, it's almost like they just automatically go there,
Hmm.
and unless they actively change that. I'm always calling it rewiring, rewire,
Yeah,
rewire,
fair
rewire.
enough.
Yeah.
Yeah, fair
So
enough.
what do you do? What have you done to rewire? So
I
you've
think,
you've
yeah,
connected to your alarm, right?
hmm yeah, finding the younger version of me. I think that was a huge one. And there's
Okay.
also things like the physiological sigh, and there's things you can do, yoga. I'm a certified yoga teacher as well. Bringing your mind and your body together, exercising regularly, that kind of thing. Looking after your diet, which I could do better at. I'm
Love
not bad, but I could do better at it. And since I read your book, I really, that book has helped me considerably. So it's just really understanding that for me, it was just connecting with that child in me that struggled, that had a
it.
parent, had a father who was schizophrenic and bipolar and never violent, but
Yeah.
very inconsistent and
Mhm.
not really knowing, when I come home from school. My mom worked a lot. She was a registered nurse. She supported the family.
Yeah.
So I kind of looked after my dad a fair amount, even when I was like
Okay.
12, 13 years old. And I
Yeah.
didn't really know what I was going to get when I got home. So there is this sense in me of like this impending doom. Like
Mhm.
you never know what you're going to get when you get home. And a lot of my patients have that too. They didn't know if mom was going to be drunk or
Inconsistency.
abusive or whatever.
Yeah.
So I think it's learning to embrace uncertainty. I think is a lot. I think a lot of anxiety is basically comes down to uncertainty intolerance, because
Yeah.
uncertainty was so unbearable for us as kids.
Hmm.
We want to avoid any kind of uncertainty as adults. But the problem with that is that life starts to become very gray when you don't allow uncertainty. You're always having to control things. And I think that's part of it. It's just being open to uncertainty for sure. Embrace it, actually embracing it. And
Hmm.
so much I think of anxiety is just internal resistance. When we resist something, we hold on to it tighter. So it's just learning how to, feel this alarm in your body and not resist it. Just allow it to be there and stay with it, because typically what happens unconsciously is we feel this alarm in our body, and because as children, we'd go into our brains and start to worry, that would distract us from the pain in our body. So we learn to live in our heads. This is what I talk about, the mind, body, head, body disconnect.
Yeah.
So it's learning how to sort of stay with that discomfort for longer and longer periods of time. And the analogy that I draw is cold plunges. So my daughter works for me. She sort of runs a lot of my company. And every 6 weeks we go down to this spa in the Inner Harbor in Victoria called the Haven Spa, which has these cold pools. So when you first go into it, your body, your mind is screaming at you, like, get out of this. This is very uncomfortable. Do not stay here.
Yeah.
So you stay in for like 15 seconds and you're like, okay, this isn't so bad. Like after 45 seconds, you're like, okay, this is good. So it's kind of like that with the alarm, is it's
Right.
really uncomfortable when you first go into it. But after a while, you build up a tolerance to it. And
Yes.
as you build up this tolerance to this internal physiological state of alarm, you no longer need to escape into your head anymore. You no longer need those worries to kind of act as a salve to this pain. You can actually, and this is what I think when people say face your fears directly, I think this is
Right.
part of it.
Yep.
Now, some
Yeah.
people, some people have, severe emotional, physical, sexual abuse. And I'm not saying that you should stay with that. You need a therapist, you need someone to help you through that. But
Yeah.
in general, we can
Yep.
learn how to find this alarm, acclimatize to it, so it doesn't automatically and unconsciously firing us into our heads with worry and try in a futile attempt to explain or avoid uncertainty, which is impossible.
Yeah. And you're talking about this, and I'm thinking about like exposure and response therapy. Is it similar
Mhm.
where like people with OCD, for example,
Yeah.
how do you cure somebody with OCD or a fear of spiders, for example? You put
Right.
them in a room with spiders, right?
Uh-huh.
Because what happens, I think, with the body is that noradrenaline release occurs, right? And you're
Yeah.
really, really scared. And then you run away from it. You never want to heal. You run
Yeah.
away from it. So your body keeps having that response every time you see spiders. But if you're in with spiders for 5, 10 minutes and they don't do anything to you and they're on the
Right.
other end of the room, your body can't tolerate that noradrenaline all the time. So it actually can't even release noradrenaline on a prolonged
Right.
basis. And then you're like, okay, this isn't that bad. And then you
Yeah.
do it again and you do it again. So is this how you treat when you say I deal with my alarm? Is that what you're talking about? You actually feel
Kind
the
of.
pain or
Kind
feel the
of.
sensations within you and kind of just sit with them?
Yeah.
Give me kind
But
of a like a what do you do in the morning to help with anxiety?
Well, I have this meditation that I created for myself that I'm trying to put into my MBRX program now, which is to be able to tolerate the alarm. Because for me, it's always in my solar plexus. I wake up with it every day.
Okay.
Um,
So you
it's
wake up
not.
anxious? You wake
I
up
wake up. I
thinking?
wake.
Yeah.
It's a great question because I
Yeah.
wake up with this alarm every day, but I don't wake up anxious because I don't allow
Mm,
or I don't facilitate the worry anymore. Because before,
interesting.
when I would wake up with this alarm in my solar plexus, immediately I would start, how's today going to go? What, have I got to do this? Is this going
Yeah.
to go wrong? Is that going to go wrong? Now it's like, no, I put my hand over it. It's like, let's just put our energy into just breathing into this alarm and just
Mm,
staying with it and treating it as if it's, the younger version of me. and
yeah.
and that's what I do now. So when people say, have you healed your anxiety, I say yes, because I've broken that loop. I still feel alarmed. It's not like I don't feel alarm anymore, but I don't give the alarm any credibility anymore.
Mm,
It's kind of like, oh yeah, I don't like this feeling, but it's okay.
yeah.
Whereas, a year ago, I'd be like, I got to escape this. This is too much for me. So
Right.
I think that's a lot of understanding that this alarm in your body is the root cause of the anxiety of your mind, because your anxiety of your mind is basically just a byproduct or a reaction to
Yeah.
this alarm. So if you
Yeah.
actually heal the alarm
Right.
and then you stop the loop of, okay, I've got this, I wake up with this alarm, I start worrying, and then, of course, the worrying aggravates the alarm, which, of course, aggravates the worrying. And I get into this alarm anxiety cycle that I talk about in the book. So now, when I feel the alarm, I just put my hand over it, breathe into it, and just kind of stay with it. And, a lot of the old, like the Buddhist philosophers and stuff say, pain is unavoidable, but suffering is optional. So
Mhm.
pain, the alarm, is probably going to be with me for the rest of my life. I don't mind it anymore. Like I don't like it, but I don't mind it so much anymore. But
You become
suffering is a
familiar
new
to it
thing.
and you've
Yeah,
understood it. It's
yeah.
become
And
your friend.
yeah, and suffering is optional. So adding thoughts to it, adding worries to it becomes optional. And as you say, with the systematic desensitization, you start learning, hey, you know what? I don't actually have to add worries to this anymore. I can just sit with the discomfort of it. So
Okay.
now it is kind of like an old friend in a way. It's like, oh, there you are. It's just, and
Yeah.
I don't just automatically start going into worry. Now, if I'm really stressed though, I will automatically go into worry and it will sort of catch up with me a little bit. But those episodes are few and far between now. Like it's not, it used to be daily, because I think the mind thinks that it can escape anxiety. And in a way, if you think about it, if the alarm is in your body and you go into your mind, in a way you are escaping this alarm that's in your body by
Right.
confusing yourself and
Absolutely. Yeah.
distracting into your mind.
Yes. Yes.
But you're just holding back this tidal wave. Like eventually it's going to smash you.
Yeah, I agree. Okay, so if you had to pick three things or three exercises or
Hmm.
whatever it is that another person who's watching this, for example,
Yeah.
can utilize to help with their anxiety,
Hmm.
what would they be? Like a one, two, three approach if you had to do that.
Well, the one I used to use a lot in the middle of the night was, am I safe in this moment? So you wake up in the middle of the night, your defenses are
I'm
down.
writing this down. I like that. Yeah.
Yeah, your defenses are down in the middle of the night, and you're freaking out about, the dentist the next morning, or your tax
Right.
bill, or, the relationship you're having with your kids or your wife or your husband or whatever. And can you just say in that moment, like, just take a breath, take a beat and go, I know all this stuff is uncomfortable. All this uncertainty is there. But in this moment that I'm in right now at, 4:02 a.m.,
I'm safe.
am I actually safe in this moment? And
Mm,
it's like, yeah, I'm safe in this moment, but it's like, no, 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 mind, just calm down for a second. But you're safe in this moment, and this moment is all we ever have, right? So, can you say, I am? Or you can say it as a direct statement, I am safe in this moment, or you can kind of ask yourself, whichever works better for you. I know I'm upset, but am I safe in this moment? Am I really safe? And the answer is always yes. You're always safe, basically, unless a bus is bearing down on you, but that's pretty rare. So that's one of my main ones that I will tell people. Now, that's a cognitive strategy, and I'm more into the body, but these are, like, you asked for quick tips, and this
yeah.
is one of the best ones. Am I safe at this moment? Is one of the best ones. Second one is probably the physiological side, because when you get anxious, it's an autonomic arousal. So your sympathetic nervous system is hot on high alert, and your norepinephrine in your
Mhm.
brain, all that stuff. So can you do the physiological sigh? So it's usually two quick sniffs in, or three, and then sort of slow exhale out. Some people do the 4-7-8 breathing. Um, I don't find 4-7-8 breathing that effective for me. I find physiological sighs a lot better. And the way I do it is I actually add three sniffs in. So three is like, and I just open up my lungs as much as I can. And then sometimes what I'll do is I'll just keep adding more air in.
Mhm.
Because
Mm.
what you're doing is you're expanding your rib cage at that point. And when your rib cage is nice and open and expanded, it sends a message up to your brain like, hey, everything's okay.
Mm.
And then as I exhale, I close my teeth and I breathe out through my teeth. So it's like,
Mm.
and I make that hissing sound. And as I make that hissing sound, I imagine an overinflated inner tube or tire like deflating.
Right.
Right. So that's the sort of advanced physiological side that I kind of teach people. And 5 rounds of that, I've rarely seen that fail anybody. When that
Interesting.
really works. So
Okay.
we get at that. And then, the third one is just realizing that you don't actually have to add worries to this feeling of alarm in your body. It's an option. You don't see it as an option because as a child, your only escape was to go into your head and worry. But you're not a child anymore. You're an adult now. You don't actually have to add thoughts to that. And instead, if you direct your attention downward into your body, find your alarm, put your hand over it, breathe into it, just try and adopt this benevolent attitude towards this alarm that's in your system, which you will find if you look for it. And those three things over the course of time and immediately will really help you understand where your anxiety comes from. But I think am I safe in this moment is probably the best initial one, followed by the physiological sigh, or do the physiological sigh first and then am I safe in this moment. Those two are probably the best sort of acute ones to do.
Yeah.
And then you just start teaching yourself over time that you're not helpless to this anxiety. You do have tools that help you. And
Right.
as a child, you didn't, but you do now. And once you start developing some agency in that you can do this for yourself, like no doctor, no pill, no strategy is going to do this. You have to do this for yourself because
Mm.
a lot of what keeps anxiety going is this victim mentality that we get when
Right.
and that victim mentality, if you have it and you stick with it, you will never heal from anxiety because it's always going to make you feel like a victim to the world. So
Well, and it never puts you in control because
exactly.
it allows you to feel it's always something else, someone else, an external problem. And maybe just listening to you, maybe I now understand what you're saying is I think as a child going through all of whatever
Hmm.
trauma or
Right.
issues, you had no control, right? And so you develop this anxiety. But now as an adult doing these practices, you're in control. And maybe that enough is soothing, right? Because
Yeah.
you're not a victim anymore. You,
And it's not a snowball anymore. It's not
yeah,
snowballing out of control anymore. Because as a child, it was everything. When you go into these like anxious phases, as a child, you didn't have power. So it was everything. It was everything
yeah,
in your periphery. Now you kind of realize, oh, this is just a part of me. There's
yeah,
other parts of me that can come in and actually help. But if you're a victim, you won't allow the victim part of you won't allow those other parts to come in and help because you are familiar in that victim role. And in that victim role, there is some perverse sense of security and safety that
yes.
never allows you to actually heal from anxiety because you stay, it's like that t-shirt that says, I'm in my own little world, but it's okay, they know me here. Right? Like you just stay in the same place. You stay in the same place
Hey,
you've always been, right?
yeah. Again, I think it's kind of related to what we talked about with it's a safe option when
Hmm.
you're in that dark world, not having to deal with the pain, playing a victim. It's not me, it's somebody else.
Hmm.
I don't
Yeah.
take responsibility for it. We have this thing in our house with my kids when they were growing up. Whenever they were afraid of something, I always would say the only way around it is through it,
Hmm.
and they hated it, but
Yeah.
we tried to practice it as much as we can. I think it helped them overcome a lot of fears. Like I think the first time they wanted to take a roller coaster. Actually, didn't want. I said, nope,
Right.
take it. The only way around is through it. And now they all
Hmm.
love roller coasters. So
Hmm.
I think doing the hard work is hard for a lot of people, but maybe knowing that if you do the hard work, eventually it's going to become
Yeah. And you have to titrate it too. Like you have to do it in small increments. So that's why when,
yes, that's
people
a
go
good
in
point.
for fear of spiders, they don't throw a spider in your face the first day, right?
No,
They, you
yes.
know,
And it's a short
so
time period, and then you increase it a little bit more and more.
yep.
Yeah,
And that's true for just about every type of healing because unless we have this sort of initial safety in our body, we don't have any foundation to put anything else on, which is one of my issues with talk therapy is they immediately go into your old emotional, physical, sexual abuse, whatever it is, and it's like that's not you're never going to get to a place of safety to form a platform that they can actually grow from if if we keep shoving the trauma in their face.
yeah. Good point. Very good point.
Mm.
Hmm. Okay. Very interesting. You talked about your MBRX program. Tell us a little bit about that in case anyone's
Yeah,
interested.
the books I wrote the original book in 2020 and it sold over 100,000 copies now, which I'm really happy with because it was a self-published book. So most I don't advertise it. Most of it's like word of
Yeah,
mouth.
that's
I know
great.
your daughter likes it and I know a lot of people really like the book.
I like it too. Yeah.
And then the second one, the second edition, because then Macmillan in the US and Penguin Random House in the UK approached me to do a second edition. And the second edition is quite a bit different than the first because I had a chance to really refine the theories are all the same, but I
Mm,
had a chance to really refine those theories and explain them just a little bit better. And then also the MBRX program is a really practical program that helps you understand what I'm saying, like how your anxiety got started, why it's there, what you can do about it. There's a yoga nidra meditation in that to sort of bring your mind and your body and your adult self and your child self back together. There's a meditation to help you find the alarm in your body as opposed to just sort of, trying to fix the thoughts in your mind. But really just my theory of anxiety and how I went through 40 years of practical therapy or traditional therapy, and it didn't really help me, right?
mm.
Until I found this, and we didn't talk too much about the psychedelics, but they
Go
actually
for it.
help. Yeah, they help me understand where the anxiety came from. Now, it's not a panacea though, because for 2 years after ayahuasca, I wasn't the same. Like I was still, suffering, and I think the ayahuasca made me worse on some level. So it's not
I
a like,
lost that type
hey,
of psychedelic. I'm not
yeah,
familiar with it.
ayahuasca, it's
Yeah.
it's it's a pretty intense one. It's
Okay.
one that Peruvian jungles, Amazon. I didn't go down there, but
Yeah.
but and there's different ones. There's the ketamine. Ketamine isn't.
It's more mainstream now.
Yeah, it's
Yeah.
not classically a psychedelic. It's a dissociative,
Right.
so it
Right.
allows you to kind of separate from yourself a little bit, but in a
Yeah.
benevolent way.
Yeah.
Then there's LSD that I did, and LSD helped me, but it was excruciatingly pain. My experiences with psychedelics have been very painful. Um, they
Interesting.
helped me understand. They helped me understand,
Yeah.
but it wasn't like I finished the psychedelics and there's this huge weight lifted off me. It's like,
Right.
oh, I feel this way now. It's like, no, it showed me different things almost academically, ironically in a very spiritual context. It showed me that the anxiety was in my body and that kind of thing. So I learned a lot
Mm.
from the psychedelics, but it didn't, when I finished them, it wasn't like there was this revelation and
Magical.
I felt so different. And
Right.
now I know some people do have that, but
Yeah.
like I just really caution people against thinking, oh, I'm not going to do 2 years of therapy. What I'll do is I'll just go down to Peru for a weekend.
Right.
It
Well,
doesn't
my
work that.
understanding of psychedelics is they're used with intense psychotherapy. Is
Should
it
be.
a one-time thing or more than once?
Well, I think it's one of those things you can only integrate so much at one time, right? Especially if you had a lot of trauma.
Yeah.
So I think
Okay.
that smaller dosage, like I'm a big fan of microdosing.
Yeah.
I don't do it myself, but I've seen the benefits of it with a lot of my patients or
Yeah.
clients or whatever they're called now. So I think it allows you to take it in increments because sometimes some traumas are just so overwhelming for people that they can't
Yeah.
approach them. It's even dipping their toe in is too painful.
But I thought
So
psychedelics help with that. Like I envision psychedelics. I've never used psychedelics, but I
yeah,
envision psychedelics for someone with anxiety or other mental health issues that are crippling is when you take the psychedelic, you're able to revisit the trauma, but like you're revisiting as if you're walking in a beautiful
An
garden or
observer. Yeah.
heaven. So, but I guess it's not like that.
Well, it can be like that. Like
Yeah.
some people experience that. Some people, like me, go through the hell of the trauma again
Mm,
under psychedelics.
okay.
So yeah, it's not this,
Interesting.
this wonderful, oh, I'm warm. There was like there's shades of that at points,
Yeah.
but for a lot of people, it's terrifying because if you look at what the psychedelics do in the brain when you put people in fMRI studies, you will see that it paralyzes something called the default mode network of the brain.
Hmm.
So the default mode network of the brain kind of separates self from other. So that's why people say, I felt one with the trees, I felt one with everything. And it also dissolves the boundary between the conscious and the unconscious. So your
Right.
dream state becomes reality. Now, if you've been stuffing trauma down for years, that dream state has been held down for years and may come back with a vengeance like it did with me. So
Mm,
it's not a panacea. So what I usually recommend for people is if I recommend doing like a year of somatic therapy first, just as a grounding before you do psychedelics, just to create this grounded place in you so that you have some resource while you're doing the psychedelic. The other thing that you can do is do it in microdoses. Now, some of the psychedelics don't work well that way, but you can do microdoses, so you can expose yourself to the trauma in a gradual kind of way. But a lot of people go in and they it's like hitting an ant with a sledgehammer. Like really, it's so powerful, and I think it is a very unique tool, but it has its drawbacks. It's not a panacea for sure. And I don't often recommend it for people with anxiety because people with anxiety need control. They hate uncertainty so much. And what a psychedelic does is it basically just forces your face right into the uncertainty,
mm,
which can be like, overcoming your fear of spiders, but it also can be re-traumatizing. So
yeah.
I think we have to be really careful. And I know in the States, there's some places that will mail you ketamine lozenges. It's just like it's becoming so commercialized. Healing
Yeah.
is becoming so commercialized now. And I don't know, but getting back to MBRX, it's sort of there's a 9 video program. The two middle videos are basically meditations, but it tells you where your anxiety comes from, what you can do about it, and how you can heal yourself, as opposed to depending on, medication, doctor, whatever, to do that for you. So that's what I like about MBRX. It's very focused, it's very practical. The book, someone sent me the thing the other day saying this is my anxiety Bible. Like it goes through all the different ways of anxiety, how it affects you, like inability to receive. Are you the first person to release a hug? Are you able to actually receive love from yourself and from others? There's different things that anxiety creates in us, and just having the knowledge and the awareness that this is what's happening is sometimes we can just say, you know what, I'm going to stay with this connection. Even though my urge is to run, I'm just going to stay with it another 5 or 10 seconds longer. And then you start just building this capacity and this resilience in your nervous system that you don't have to run away from uncertainty all the time. And I think once you learn that, kind of like systematic desensitization, once you learn that, you can sort of stay with uncertainty for longer and longer and longer. And then you're kind of attacking the top down framework where you're forcing yourself to worry, where you realize, I don't really need to worry in this situation. I can just leave the uncertain at this point and be okay with that. So I
Yeah.
think that's MBRX is really practical. Like if you had to do one thing, the book or MBR, I would do MBRX. And I keep like the thing, MBRX is like $100. It's like less than a cost. And this is the reason why I really object to the business of trauma. Like it really
Yeah.
bothers me that people are charging thousands and thousands of dollars
I
for
know.
things that often don't even work,
I know.
right?
Yeah.
So it's like the
Yeah.
book, if you get the book, if you get the MBRX program, you'll know more about anxiety than 99% of therapists do.
And is the MBRX program, is it videos of you talking and
Yeah,
kind
it's me. Yeah.
of, I
So
think a
there's
lot of people are
nine.
more visual. Like I'm
Yeah.
personally more of a visual learner than I
Yep.
am. Like I like to read, but if I had the choice, I would definitely, I think I connect more when I see something visual.
I think that's true. And again, that's the social engagement system, right? So
Yeah.
like social and people
Yeah.
say, not when I have a cold like I do now, but people say that my voice is fairly soothing.
It
So
is actually. Yes.
yeah, my
Yeah.
father was a radio announcer. Like he
Oh,
and
interesting.
Peter Jennings, the radio
Yeah, I know Peter.
newscaster. Yeah, he once told my dad that my dad had the smoothest radio voice he'd ever heard.
Oh,
This is
wow.
this is back in like the late 1950s in
Oh,
Sudbury, Ontario, right?
wow.
So, yeah,
Very cool. Very nice. Thank you so much, Dr. Kennedy,
of course, Christine,
also
anytime.
for having me on, for being on. I'm sorry.
Yeah, well, you were on mine
I
recently,
was
so
on yours, right? And I've been doing the rounds too. So, but
good.
it's funny. I was thinking that when you were saying patients or clients, yeah, I don't know what to say anymore. I feel like patients has become a taboo word
I
now,
think
right?
it is in a way. It is in a way
Yeah.
because it's like
What is
there
that?
is this sort of, patriarchal, I'm the doctor, you're the patient thing,
Right.
and everybody's supposed to be like kind of even now. And I
Right.
think
But
there
I also
is,
feel like patient, like it implies that you're ill
yeah,
or well,
yeah,
right? Whereas
yeah,
client,
for
like,
sure.
I'm in control. So,
Yeah.
but
And I
anyway,
think that's important.
yeah.
Just for people to know that they actually have more power in their own healing than what the whole, you know,
What the
patient
medical
doctor
society
part.
has taught
Exactly.
them, right?
Exactly.
Yes, I'm all about empowering another person to make their body a really great
You
healer.
do a great job. Like
You do
your
too.
book's amazing,
Thank
and it's
you.
so easy to read. That's why I really like about it. You see a lot of things, and I don't. We're almost coming to the end here, but
Yeah,
what I call internet hell is when you get two equally credentialed experts saying the exact opposite things,
I know.
right?
I know.
It's so difficult for people. Like,
Yeah,
how are people supposed to know when one person is saying seed oils are the worst thing in the world, and then other people are saying no, they're actually really good for you, and they're
yeah.
both equally credentialed, right? So it's like and again, it's the business of trauma. Everybody wants to know.
I know, and I think at the end of the day, you have to be rational, and that's really what I try to do. Is just, and that's what I try to do. Is you're not going to be perfect in your diet, and you're not going to be
Yeah,
perfect in this or that. Just be rational.
yeah,
Do the good stuff 80% of the time.
yeah.
But yeah, I agree with you. But anyway, thank you so much. I appreciate
Anytime, Christine.
coming on.
Anytime.